Urinary incontinence. It's a condition that strikes millions of women, interrupting their sleep and impacting their relationships. Urinary incontinence is the accidental release of urine. 30 million women are afflicted, yet embarrassment keeps many from discussing it, even with their own doctors. Susan Elder's discomfort was constantly on her mind.
Symptoms were a heaviness in my pelvic area, a frequent feel that I had to urinate, difficulty in exercising because you felt this pressure in the pelvic area. There were just issues that complicated my life a little bit.
There are two major kinds of incontinence. Stress incontinence, which is the leakage of urine when a woman coughs, sneezes, or jogs, or puts other pressure on her bladder. Or urge incontinence, when a woman has a sudden urgent need to urinate and may not make it to the bathroom in time. There are many causes of either type, and specialists like Dr. Jeffrey Dell say accurate testing is the key to successful treatment.
There are a variety of steps that we go through to analyze the patient's problems and then move towards a treatment plan. So we start with a history, an evaluation of what the symptoms are, what the main problems are for the patient. We then move to a pelvic floor examination to look at all of the different aspects of the anatomy that may be involved. And then finally we move on to some complex or comprehensive testing called urodynamics and cystoscopy. And in moving through that process, we're able to formulate an opinion about how the patient could be best served.
Once the type of incontinence is identified, a customized treatment plan is executed. For some, physical therapy or medications are enough. Others require electrostimulation or surgery.
Mild incontinence or mild prolapse can often be helped with physical therapy. We have a variety of medications that can be very helpful, particularly for overactive bladder symptoms. Can frequently be helped with a once-a-day overactive bladder pill. When patients have very difficult types of incontinence to treat, particularly urge incontinence, very severe overactive bladder type symptoms, we often can gain tremendous relief for them with electrical stimulation. And there are a variety of techniques to do this, but InterStim therapy is our primary mode of sacral nerve stimulation. This involves planting a lead next to one of the nerves that's most related to bladder function that provides a little bit of electrical stimulation or impulse to those nerves, and then very often can help bring back to normalcy that abnormal bladder function. Patients sometimes will require a comprehensive surgical approach to get the needs that they have met, particularly if they've failed more conservative measures. And so surgery is typically going to be done for stress incontinence or significant pelvic organ prolapse, where the patient has a sense of things literally falling down or out of position. And when those symptoms are becoming very disruptive to the patient's quality of life and interfering with her daily activities, then very often a surgical approach is necessary.
Susan underwent surgery and her symptoms have disappeared. She says the treatment was life-changing.
My life is great right now. The surgery was a success. My follow-up visits, everything is still in place. I feel like I did in my 30s.
I think the important message for women is that, number one, they are not alone. These kinds of problems are incredibly common. 30 to 50% of the female population deals with these very same issues. Number two, even if they've sought help from a number of physicians or even had previous surgeries or treatments, if they're continuing to struggle, don't give up. There is hope, there is help, and continue to take that next step and seek the care that will eventually come their way.
The Institute for Female Pelvic Medicine is a national leader in treating women's health issues, specializing in conditions like incontinence, prolapse, and painful interstitial cystitis, which collectively affects 50% of women. This dedicated team focuses solely on urogynecology and reconstructive pelvic surgery, delivering state-of-the-art care in a warm, welcoming facility.
I think there are at least three things that set the Institute for Female Pelvic Medicine apart from a lot of clinical settings. I think number one, we listen to what the patients have to say. How are things adversely affecting her? What issues does she most seriously want to have addressed? So we listen to the patients very carefully on the front end. Secondly, I think we love what we do. And while we deal with complex patients and very challenging issues, but we have a passion for what we do. And then finally, I think we certainly treat our patients with the dignity and respect that they deserve. Every patient has got individual, unique features. So we really try to have a customized, individualized approach that really is tailored to meet the needs of that specific patient.
A division of Generations OBGYN, the Institute for Female Pelvic Medicine is headed by Dr. Jeffrey Dell. Dr. Dell is a renowned physician and surgeon often called upon to repair failed mesh procedures. He and his patients embark on a journey together to uncover the cause of their symptoms and find effective therapies.
My quality of life has improved greatly thanks to Dr. Dell. I'm able to spend time with my family more, and I'm not spending most of my time in the bathroom. I just have a better quality of life all the way around. Dr. Dell's bedside manners are unreal. He's a very compassionate doctor. He doesn't just keep trying different medicines and jerking you back and forth like you've been to several other doctors, like, well, let's try this. No, it didn't work. His interest is helping you to get better. That is his main focus, is to help you. Oh, Dr. Dell's bedside manner is wonderful. The minute I walked into his office, I felt at ease, and his staff, very professional. His knowledge is unbelievable. He knows exactly, he leaned back in his chair and he knew exactly what I was talking about. So of course you feel like I'm in the right place.
There's no need to suffer in silence with incontinence or pelvic pain. Contact the Institute for Female Pelvic Medicine at mypelvicmedicine.com.